Hello everyone, welcome back. Today I'm going to be talking about bone histology, the histology of the bone tissue. So the main question is, are bones organs? Are they? Really? If you go back to the introduction to A&P, you will remember we talked about the organizational structure of the human body, where we talked about a bunch of cells will make up tissues and a bunch of tissues will make up an organ. So yeah, that will fall into that category. A bunch of bone tissue will make an organ. So bone is divided into two parts, the compact and spongy bone. Compact bone is usually, when we look at bone, what we see, it's compact, it's smooth, it's solid, has no holes on it. While spongy bone is the opposite. It's made up of a kind of like a honeycomb-like structure. It will resemble a sponge, and have some flat pieces of bone that we call trabeculi. I'm just going to talk about trabeculi later on. And there are also going to be open spaces between the trabeculi, which could be filled with either red bone marrow or yellow bone marrow. So let's look at the gross anatomy. And the example I'm going to be looking at today would be irregular and flat bones. So, that we would see in a place like the skull or the sternum. And these consist of thin plates of spongy bone, which we call diploid. And they're usually covered by compact bone. So I like to call it kind of like their sandwich. The spongy bone is the meaty part and middle portion of the sandwich, while the bread would be compact bone. And we're going to see some membranes here, and they might not be the typical membranes you're used to, but they are called periosteum and endosteum. So peri usually means surrounding. So we are going to see this outside of the compact bone. This gives, almost like a layer on top of the compact bone. If you have ever seen either a fake bone or a real bone, you would notice that you would not see the periosteum because it's only found in living tissue and living bones. And this also serves to give a separation between muscles or anything else that might be directly touching the bone. While endosteum, the word endo means inner or within, we're going to see this lining the inside portion of the compact bone. We're also going to see endosteum, in the spongy bone. So bone marrow is scattered throughout spongy bone. There's no defined marrow cavity. We're going to see how that is different from compact bone in that there's a certain structure to it. And in spongy bone, we're now going to see osteon. Osteons are very unique to compact bone. We're going to see trabeculi instead, and we're also going to see osteocytes. So we're going to first start with looking at the structure of a typical long bones. All long bones, and when I mean long, it doesn't have to be your just maybe your legs, your thigh bone, your arm bones, but long bones, we're talking about like the length is longer than the width. So even your fingers are considered long bones. So all of these bones are going to have a shaft, which we call diaphysis, and the ends of the bones will be called the epiphysis. And we're going to have two ends, one on the top, one on the bottom, but we don't call them that. We call them the one closer to the head portion would be the proximal epiphysis, and then the one farther away would be the distal epiphysis. So if you haven't mastered your directional terms, make sure you go check out that video. And in diaphysis, which we call the shaft, this is going to consist of the compact bone surrounding kind of like the central medullary cavity. And this is going to be filled with yellow marrow in adults. If it's in children, it'll be filled with, or babies, it'll be filled with red bone marrow, because that's going to be needed for hematopoiesis, making a lot of blood. But in adults, we adults are, unless someone is severely anemic, which I'll talk a little bit about that. But the epiphysis is usually where we're going to see articular cartilage. Articular cartilage is not another type of cartilage. The word articular just means to join or connect. So one of the things that we're going to be using, the term we're going to be using moving forward will be articulating. In English, if someone's articulate, they're very, good with words and their words are smooth and all of that. But in anatomy, this is why we say you have to learn the language of anatomy because it's totally different. Articular or articulating means to join or to connect. So we're going to say this bone articulates with that bone. And we are going to see cartilage at the ends of every bone because we don't want a situation where bones rub off on each other. In cases like arthritis, that's actually the problem. The problem is that cartilage that's supposed to protect the bone has worn off, and now you have bone crushing, rubbing against each other. You have nerves in there, and that's going to be very painful. And it's one of those things when you have your patients and they're asking you, what can I do? What can I do to stop this pain? There is no, we can give like steroid shots to decrease inflammation, but we cannot replace cartilage. And unfortunately, it's just something that we have to do to decrease your pain, but we cannot fix it except, maybe a knee replacement or a hip replacement. But going back to the bones, metaphysis. So metaphysis is not something that you really see everywhere. It's going to be a very small structure. It's not really that much defined between the diaphysis and the epiphysis. This is especially important when we're talking about fracture, like a metaphyseal fracture, and so on. And between the diaphysis and the epiphysis, we see something called the epiphyseal line. All right, the epiphyseal line, you can see that on the diagram here. And the epiphyseal line, if you notice here, it's all bone. The previous video, go check that out. If you were to take a look at it, you would see a blue line, meaning that it's cartilage. So the epiphyseal line becomes epiphyseal plate. So epiphyseal plate, this is where bone growth occurs. We see cartilage because this allows the bone to grow longer. All right. So, and we would expect to see that where? In children, they're still growing. So we would expect to see cartilage there. So let's say you take an x-ray. You take an x-ray of a patient, and obviously the ages are going to be on there, but you can tell based on the age, based on the cartilage, if this is a child or if it's an adult. So right here, the diagram that's on this page right now is the bone of an adult because there is clearly no cartilage in the epiphyseal plate. It has become a line, and this is telling us or showing us that this person is no longer going to grow anymore, at least not in terms of the length. So that's very important. If we were to see this in a child, if we were looking at an x-ray, we are going to see a line, and it will look like there's a fracture because it will look like nothing's there because cartilage doesn't show up on x-ray. So if you see, it doesn't mean that, oh no, I think you have a fracture that you don't know about. No, it means that they're a child. So red marrow is found within the trabecular cavities of spongy bone and the diploid flat bones. In newborns, I mentioned that they are going to contain red marrow because they're making a lot of blood. In adults, this red marrow is located in the heads of the femur and the humerus. The femur is your thigh bone. The humerus is your arm bone. The next video after this will be the axial skeleton. And this is the most active areas of hematopoiesis. Hematopoiesis is the formation of blood. Every single blood in your body is made in your bone. So, I want to segue a little bit. So if we say that someone, for example, has bone cancer and they are severely anemic, it makes sense. If the warehouse, the factory, is damaged or not working properly, then production will slow down or, it will not work. So, and this is also important when, for bone marrow transplant, for example, patients might say, I want to, do bone marrow transplants, but then we can only get this stem cells, specifically from certain areas. And where would we go? The heads of the femur, the heads of the humerus. It's very painful. And sometimes patients get confused, like, why can't you just do it somewhere else? Well, this is the most active area of hematopoiesis. That is why. And yellow marrow can convert to red if person becomes anemic. So, like I mentioned, in adults, if a healthy adult, it'll be yellow, but if an adult becomes severely anemic, the body will go into overdrive trying to replenish or make more blood, and is going to convert the yellow marrow to red bone marrow. So another thing you can see, would be the periosteum. I mentioned the periosteum. You can see that a little bit better here from the previous diagram. The periosteum, it looks white. It's a double layer membrane. It covers the external surfaces except the joints, which that would be the articular cartilage. And by the way, I forgot to mention that the articular cartilage at the ends of bones are going to be hyaline cartilage. Okay, so this periosteum is very important because it contains many nerve fibers, blood vessels. As you can see this blood vessel piercing through the periosteum, and there's what we call perforating fibers, which are basically a bunch of collagen extending to the bone matrix, and their job is to secure the periosteum to the bone. And these membranes also, especially the periosteum, acts as an anchoring points for tendons and ligaments. And here you are going to see the endosteum. The endosteum is a little bit more delicate than the periosteum, and this is going to cover the internal bone surface. And this also covers the trabecular spongy bone and lines the canals that passes through the compact bone. So as you can see, bone's well vascularized. When you see bone from the outside, it doesn't look like it, but it has a lot of blood vessels, besides the fact that blood is made there, but it also has a lot of blood vessels. There are nutrient arteries and veins. These are the main ones that supply blood to the diaphysis, and they enter the bone through what we call nutrient foramen, which is basically a hole in the bone for all of these blood vessels to go through. So we're looking now at the microscopic anatomy of compact bone. We're done with the gross anatomy. This consists of osteon, also called Hervasian system. And we can see, in this diagram here, and an osteon is the structural unit of compact bone. All right, this is the structural unit, and it consists of, it looks like an elongated cylinder, and this acts as tiny weight-bearing pillars. One of the things that you will see here are the fibers. All right, the fibers that we see in the lamellae. So the lamellae are the rings that basically, make up a bunch of lamellae rings, is what form an osteon. All right, and we see that the fibers, the collagen fibers, I want to segue a little bit, but if you remember connective tissue, we see collagen. It just depends on the amount of collagen that each tissue has. So lamellae, you can see, one of the things I want you to see, the direction of the collagen fibers. They run in different directions, almost opposite to each other. So this, as a result, acts as a weight-bearing pillars. So this allows bone to be very strong. This is why, let's say you're 100 pounds, you can lift or, you push something that weighs more than you without your bone crushing under that weight. So that's very significant. And, it helps the bone to withstand stress and also resist twisting. All right, so when you're stretching, your bone doesn't, just fall apart as a result of that. Someone might say, well, I thought that was the job of calcium, and calcium plays a role, yes, but the structure, we're now looking at the structure of the bone tissue. So now we're looking at the central or Hervasian canal. So what we're going to see here is that it runs through the core of the osteon. This is where we're going to see the blood vessels, we're going to see some nerves, and then we also have perforating or Volkmann's canals. So what's going to be the difference between the central canal and the perforating canal? So think of it this way. The central canal is going to be the water going into your house, into your apartment, while the perforating canal will be where all that water is coming from, which is going to be, everyone on your street, on your block is having their water from a main water source, and that's going to be the perforating canal. You can also say, your sewage goes into another main source, and that's going to be the perforating canal. So the perforating canals will connect all of the blood vessels and nerve from the osteon. From all of them will drain there, and then blood also supplied there, and we find them in the medullary cavity and the central canal. And then we have lacunae. Lacunae, this is not a new term. If you remember in the previous video, I talked about chondrocytes. Chondrocytes are cartilage cells that reside in lacunae, which are tiny pockets. So we're also seeing that here. Osteocytes are mature bone cells that reside, or they are located in lacunae. And then there's canaliculi. You can see canaliculi. A better picture would be in the far right bottom video on your page here. And canaliculi are tiny canals. They're hair-like. All these are microscopic, right? Hair-like canals that connects the lacunae to each other and to the central canal, because then how then can one osteocyte communicate with another osteocyte if it's in a pocket somewhere? So that's going to be the job of the lacunae. Not only do they communicate, they allow nutrients and waste to be relayed from one cell to another. So that concludes the bone histology chapter. All right, thank you. I hope you learn a lot. Thank you. Bye-bye.